Wonderful. So people are trickling in. We have a very high registration number this afternoon. We had, I think, just under 500 people who registered. Let's see how many people can make time for us this afternoon.
Hello, everybody.
Hello, everyone.
We're also live on Facebook.
We're also live on Facebook, exactly. So people keep coming in. Wonderful, thank you so much. And a very warm welcome to today's EU-ASEAN ASEAN session. Today we are focusing on opportunities in the thematic area of biomedicine and health for collaborative research in the Horizon Europe European Research Program. This is just one session in a series of events that is running between May and September. This is a series of events under the flagship EU-ASEAN collaboration in research and innovation. So thank you so much for joining us today. And organizing today's event for you is EU-ASEAN ASEAN. My name is Susanna Ransovaso, and I'm here with my colleague, Dr. Jenny Elmako.
Hello, everybody. Thank you so much for joining us. Please do use the box, the Q&A box, or put your questions on the chat. We would really love this to be an interactive session for all of you.
Exactly. So we are your interlocutors here in the region. If you have questions about today's session or anything else related to research collaboration with Europe, please reach out to us. Our email address is here at the bottom of the slide. And of course, we are collaborating extremely closely with our colleagues at the ASEAN S&T division, the S&T division of the ASEAN Secretariat. And at this point, of course, a very warm thank you to Dr. Serena Mokhtar and her entire team for helping us organize today's event. Now, what do we have on the agenda today? As we said, we're focusing today on the thematic area of biomedicine and health, and we're presenting to you very concrete opportunities where you as an ASEAN research entity can collaborate with partners in Europe and beyond. We're presenting to you forthcoming Horizon Europe calls for proposal. We have invited our wonderful colleagues from the European Network of National Contact Points, and they will give us very detailed information about the calls and how you can participate. We also have a roundtable with project partners in current Horizon Europe Research Consortia. We do realize this is specifically or particularly interesting to you, how you can build your network, how you can become part of a European Research Consortium. And our three expert speakers later in the afternoon will share some advice on how you can also extend your network towards Europe. We have also created for you a tutorial. Our colleague, Dr. Dalibor, has created a recorded tutorial on key aspects of how international partners can participate in Horizon Europe Research Consortia. So all of this is coming up today. And as Jenny has said, we want this to be as interactive as possible. If you want, you can also introduce yourself in the chat box, but please post your questions in the Q&A box. It's a lot easier for us to find your questions, and we can then direct them to our speakers today. If you would like to ask a question live and you want to open your microphone and your video, then please send us a little chat, a message in the chat, and we can then arrange for you to open your microphone. And just a final reminder, we will share the recordings and the slides of today's session in the coming days, so you will have all the information at hand, so you do not need to worry. Now, again, I hope you are all settled. We have quite a long program ahead of us, but before we commence today's agenda, we are very honored to have with us a tandem of speakers that represent the very close partnership between ASEAN and the European Union in science and technology, and they have kindly agreed to open our session. Firstly, it is my great pleasure to welcome Dr. Sisay Palami, who is the chair of the ASEAN COSTI Subcommittee on Biotechnology And he is also the head of the Pharmaceutical Sciences Department at the Faculty of Pharmacy of the University of Health Sciences of the Lao People's Democratic Republic. Dr. Palami, the floor is yours.
Good morning in Sat time and good afternoon in Jakarta time. Thank you, Dr. Susanis, for your kind introduction. His Excellency Mr. Igor Dimes, EU Ambassador to ASEAN. Ladies and gentlemen, on behalf of the SCB Chair, I am Dr. Sisai Palami, and I would like to extend a warm welcome to all delegates who have joined us today as the Horizon Europe Knowledge Burger section with Asian Costi Section 2, thematic focus on biomedicine and health. Ladies and gentlemen, the significance of this event series cannot be overstated. It represents a bold style towards strengthening Asian participation in Horizon Europe, a program renowned for its support of cutting-edge research, innovation, and transformative ideas. By joining forces, we may unlock the potential for groundbreaking advancement in biomedicine and healthcare, driving progress and improving life across our nation. I would like to express my gratitude to all the SCB members for the participation in this meeting and for the continued support towards our shared goal of advancing research and innovation in the ASEAN region. And I would like to also extend my sincere appreciation to all our partners, including the ASEAN Secretariat, ASEAN, the European Commission Directorate General for Research and Innovation, and the esteemed member of COSTI. Your unwavering commitments, expert, and collaborative spirits are essential pillar of this initiative success. With the spirit of the collaboration among the subcommittee members, I am hopeful that this section will be productive, result in significant decision that will be benefit the Asian community. And thank you, and I wish you all successful and fruitful meeting.
Thank you so much, Dr. Palami, and we're exceptionally grateful for the support of ASEAN COSTI. Thank you so much. Now it is our great pleasure to welcome our second guest speaker, and it is His Excellency Igor Driesman, the European Union Ambassador to ASEAN, who's based in Jakarta. Ambassador Driesman has recorded his welcome message to us because he's very, very busy, of course. So we're going to play his message to us now.
Dr. Sisai Palami, Chair of the ASEAN COSTI Subcommittee on Biotechnology and Head of the Pharmaceutical Science Department of the Faculty of Pharmacy of the University of Health Sciences Lao PDR, Dr. Susanna Rensau Vasu, Regional Coordinator for Euraxis Worldwide, and distinguished researchers and all of you there in the audience. I'm so very pleased to welcome you to today's information session of EU-ASEAN collaboration in science, research and innovation as part of the Horizon Europe Info series. Horizon Europe is the EU transnational research and innovation program with a budget allocation of 95.5 billion euros for the period 2021-2027. It represents an increase of 30% compared to the previous period, showing the importance that the EU gives to research and innovation. Horizon Europe is a key instrument to see beyond the horizon and tackle global challenges, including building green, digital, healthy, and resilient societies. In line with the EU Global Gateway strategy to promote investments in quality infrastructure, education, and research, including collaboration between networks and communities of education and research, is a top priority of EU external action. Today's webinar aims to encourage the participation of ASEAN research institutions in calls for proposal to undertake collaborative research projects with European partners in the thematic area of health and biotech. The fields of biotechnology and healthcare has been rapidly evolving, presenting tremendous opportunities for research and innovation. And by facilitating collaboration and knowledge exchange between the European Union and ASEAN, we can leverage our collective expertise and resources to address pressing healthcare challenges, improve patient outcomes, make a lasting impact on the healthcare landscape, and drive economic growth. So, I would like to extend my gratitude to our esteemed panelists and speakers for their valuable contributions today, and also my appreciation to the ASEAN COSTI, because pursuing dialogue between the ASEAN Committee on Science, Technology and Innovation and the EU to promote cooperation in science, technology and innovation is a priority of the EU-ASEAN Plan of Action 2023-2027. Finally, a big thanks to Euraxis and to all partners for their valuable contribution to make this webinar possible. Thank you very much.
Thank you so much also to Ambassador Igor, who's a really great support of our work. So we're grateful to him specifically. Now, both our guest speakers, Dr. Palami, Dr. Driesmans, thank you so much. Now we see that you're already using the chat function to introduce yourselves. Keep doing that. That's always interesting for us to see who you are. And we have, in fact, created a little poll. And I'd like to just launch this poll very quickly, just for us to get a little bit of an idea of who is in the session today. We have 200 people that have signed in right now, and you can see there's a few questions for us. I hope you can access the poll. Jenny, if it's not working, it is perfect, just for us to get an idea how familiar you are already with Horizon Europe, or if perhaps you're already participating in Horizon Europe funded projects. So we just give you a couple of minutes to give us your feedback. And we can see 201 persons have joined us. We have today people from all over Southeast Asia. All 10 ASEAN member countries are represented. That's fantastic. So we do hope you find the session very useful. We're going to turn our attention in a minute to what is underpinning Horizon Europe. Horizon Europe is open to the world, so international collaboration is extremely important to this entire endeavor. And our first speaker this afternoon will share with us a little bit of information why international cooperation takes center stage in the Horizon Europe program. We're going to welcome in a second Mr. Benoit Sauvaroche, who is joining us this afternoon from the European Union delegation to Singapore, where he's just taken on the portfolio of science and technology, among many, many other things. He has just arrived from the EU delegation to India, where he held the position of first counselor for digital transformation. So Benoit this afternoon has kindly agreed to tell us a little bit about the importance of international cooperation in Horizon Europe. Benoit, the floor is yours.
Thank you, Suzanne, and congratulations to you and Jenny for organizing this event, which is definitely very, very useful. And I think the result of the poll will show it once again. I'm very happy to have this opportunity to explain to the many participants, as you mentioned, what is underpinning this call for for participation to Horizon Europe. I would like, yes, to present what is the European vision on research and innovation and why we are open to the world, and we invite you to come and participate. As Suzanne mentioned, I've been recently allocated to the delegation of the European Union to Singapore, where we'll be in charge of the collaboration on research and innovation, which is just one of the token of the specific interest of the European Commission into Singapore and the region and ASEAN. And why are we so keen in getting international involvement? I think I need to explain a bit of the strategy of the European Union, which has been adopted a bit more than 2 years ago, which is a global approach on research and innovation. And the first element is, of course, the global nature of the challenges that we have. Of course, climate change is the first one that everybody is talking about. Digital transformation is equally global, but the topic of today, health, I mean, we saw it with the COVID crisis, that there are topics which are of global nature and need a global response. And even though we are strong enough in the European Union and beyond with our network of European countries, we do believe that we need also the participation of the rest of the world. We don't need it at any cost. And the strategy of the European Union is underpinned by certain principles for this collaboration, international collaboration on research and innovation. Some of these principles are reciprocal openness, for instance, or free exchange of ideas in order to have co-creation of innovations. So we have a set of principles that are driving us, but also values that we intend to have respected within our international collaborations. And among these values, I would like to cite a few of them, such as academic freedom or ethics and integrity, where we do believe and we are driven by the vision of human-centered technological innovation. So definitely keeping the human being at the center and the finality as well. We defend also values such as gender equality in research, but also open data and open science, to be sure that, for instance, data sets are findable, accessible, interoperable, and reusable. So using these values, we are promoting this Horizon Europe that the ambassador Driesman mentioned about, this flagship program, which is running until 2027. And for this, so this Horizon Europe program is indeed not only for the EU, but open to the world. And we are promoting participation of third countries. This participation can happen on different levels. So we first have tools for individual mobility, for exchange of scientists, but beyond that, and that's the topic of today, we are also opening calls for collaborative research. And this can happen under different modalities. For the majority of ASEAN countries can be beneficiary of these calls, in the sense that not only they are open to you, but also you can benefit from funding of your participation, which is not the case for all the countries in ASEAN. For instance, here in Singapore, considering, I mean, the level of the country, this happens on the basis of co-funding, where the Singaporean will fund, I mean, their part in the research, but it's equally open to their participation. We also have other type of participation where we can go even beyond, with some countries joining on an equal part, including for funding the Horizon Europe set of countries through an association agreement. These calls are on 6 pillars. The Horizon Europe is divided into 6 pillars. The first one is health, which is a topic of today. So it's definitely a topic of major importance. And why we are happy to have you participating is that because we believe that you can both contribute to the perspective of the European Union, but also you can benefit from this collaboration. And we like to end with that. First, contribution. I think you can bring your perspective, and it would be enriching and bringing your exchange of ideas, enhancing also the visibility of ASEAN and the recognition of ASEAN within the European network. So you can definitely bring an element, but also connect with peers in the EU. Of course, you can benefit also from this collaboration, collaborative research, first by accessing a rich network, including network of resources, including data repositories. You can, of course, as I mentioned, for the majority of the ASEAN countries, benefit from funding, but also benefit by accelerating the scientific progress, I mean, in your own institutions and countries, and also possibly expand the scope of your work by this collaboration. So definitely what we are looking for is combining knowledge and expertise. And in particular today, I mean, in order to strengthen the healthcare system, improve public health outcomes, and enhance, in the end, the well-being of our populations, not only in ASEAN or in the EU, but through the world. Thank you very much.
Thank you so much, Benoit, and welcome again to Southeast Asia. I'm sure you will soon realize what a fantastic community of researchers we have here in the region. Jenny and I have been working here for a long time, and we're always stunned at the amazing research that comes out of Southeast Asia. So thank you once again for your presentation. And as we have heard, Horizon Europe is, of course, open to the world. And before we continue with the session today, which is really to provide you with very specific information about Horizon, I want to just take just a couple of minutes to focus our minds about what we're talking about today. So we've heard from Benoit already, Horizon Europe is open to the world. So international collaboration very much underpins this program. What we're talking about today is the EU's key funding program for research and innovation. It is a program that in its current form will run until 2027. And you can see it has an overall budget of just over 95 billion euros. What is important for us to remember is the program is implemented in annual work plans, which means each year there's a new set of calls that are being published. So it's important to keep that in mind, even if what you're hearing today is not of interest to you, there'll be new calls coming out in the next years. And as we've said, international collaboration is very much at the center of this particular program. This is what it looks like, and Benoit has already alluded to it. It is organized according to 3 pillars, and we're looking today at pillar 2. This is where we find the so-called global challenges and the European industrial competitiveness. And as we've heard, these global challenges, these clusters, are organized along 6 thematic themes, 6 topics. And importantly, again, the bulk of funding is in these clusters, in pillar 2. What is important for us before we're starting to present the calls to you is pillar 2 offers opportunities for collaborative research between institutions. So this is not for individual researchers that are perhaps looking for PhD funding or for an individual postdoc fund. This is really for institutions that come together, they form a so-called consortium, and together they are carrying out the research. There's a certain requirement what this consortium should look like, and you can see it must be comprised of at least one partner from an EU member state. There are currently 27, and we must have at least 2 additional partners, either from an EU member state or a so-called associated country. Now, associated countries are countries that pay into the Horizon Europe budget. All the 10 ASEAN countries are currently so-called third countries. Third country just means you're neither an EU member state, you're not an associated country, you're an EU country. And importantly, each consortium, once it has fulfilled this minimum requirement, can add as many third country partners as it is necessary to carry out the project. So this just for us to, in a way, focus our minds. And we're now turning our attention to the key part of today's event, namely the forthcoming calls for proposal in the field of health and biotechnology. And we have 3 speakers coming to us from the National Contact Point Network. These are fantastic people. You will find out for yourselves in just a minute, full of information and full of ideas on how to support you. The first person today taking the floor is Dr. Francesca Borelli. She is Senior EU Funding Advisor and National Contact Point at Lux Innovation for the Health Cluster, Cluster 1, and also for the European Research Council grants of the Horizon Europe funding program in Luxembourg. And Francesca has the big task today of presenting 5 calls that are coming up under Horizon Europe Work Program 23-24 in the health cluster. So Francesca, the floor is yours.
Hello, and thank you for inviting me. Thank you, Suzanne and Jen, for this event. I'm very happy to present, unfortunately, 4 calls because the 50 was just a repetition. So I will present 4 of the calls, but I will give you also some information on the health cluster of the Horizon Europe program. I will share now my slide. Let's see, then you tell me if everything works fine and I can.
Yes, fantastic.
Yeah. So I am Francesca Borelli and I am National Contact Points for Luxembourg at Lux Innovation. So in Europe, but not only in European Union, also in several countries all over the world, there is this network of national contact points which try to help organizations in be involved in Horizon 20, in Horizon Europe, sorry. Today, I will talk to you a little bit about the cluster health. The cluster health, the first thing, which is another, let's say, a step of the cluster health is subdivided in 6 destinations. We can say 6 subgroups of the cluster health. And I want to tell you this because it's very important when you approach a topic of the Horizon Europe program in health that you really understand under which one of these destinations is, because these destinations have been developed to have different impacts in the health sector, and they follow different policies. So something, even if a disease is developed, is tackled in different destinations, there might be differences. So it's very important that when you read the topics, read also the introduction to the topic, which is the destination. And today I will talk to you about 4 of the topics under the cluster. First of all, I saw that a lot of you are new to the program, and this is very good to see so much interest. And I see that some of you are not very informed about the portal of the European Commission, where there are all the calls. So I put here you a link just now when you have the slide where you can go and familiarize with this portal, because I think this is the really first step when you want to participate to the Horizon Europe program. In this portal, you find all calls which are open and will open, and also the ones that are closed. So today I will present you 2 topics under Destination 5, 1 topic under Destination 3, and 1 topic under Destination 4. Also, the structure sometimes of this proposal, it's a little bit different. you have some proposal which are 2 stages proposal. This means, and this in particular, the innovative non-animal human-based tools and the ensuring access to innovative high-quality healthcare. These are 2 stages. It means that you will have to submit a first proposal, reduced proposal, and if it's successful, you will be invited to the full proposal submission. While some other proposal, which I indicated here as a single, they have only 1 submission, which will be next year in April. So some proposals have 2 stages, and the first stage is already now in on September 19 this year, while some are single stage, and the deadline to submit the proposal is April 2024. Now let's go into the proposal. I want to present very briefly also the destination, because I think it's very important to understand where we are. Destination 5 is on technologies, technology for the healthcare. So we want, the European Commission want to create more knowledge and more cost-efficient solution which have impact on the healthcare, and to help healthcare system to become more accessible and more also give access to all people in Europe and worldwide. So the key objective under this destination, as you see, is promoting a strategic autonomy by leading development of key digital emerging technology. This is very important to keep into account. And the impacts of all topics that have been developed under this destination is to have a European Union more knowledgeable and more use cost-effective solution, technologies, also digital solution. And this is also because you know that the healthcare system have a high burden of disease, which are very costly. So this is also to reduce the cost, using effective solution to reduce the burden of disease on the healthcare system. Of course, also these technologies and these new tools should be accepted by the citizens. So we should use technologies and data in the correct way. So now let's go to the first topic. The first topic, it's called the Innovative Non-Animal Human-Based Tool and Strategy for Biomedical Research. So as you can understand, also the title is very self-explicative. Here we are in the domain that European Commission wants to have more models and technology that do not use animal models. There is evidence that there are a lot of animal models that are used, but not always these animal models are is possible to translate into human condition with the expected impact and the expected benefit. So here in this topic, the European Commission looks for proposals that present new solution and new technology to have fewer animals used in biomedical research, to have new tools that are more effective to the human condition and situation, and also research which is more sustainable and more acceptable at European and worldwide level. Of course, this tool should be, the final outcome is always the benefit of the patients and of the citizens. So this non-animal model should be also better positioned when they are translated into healthcare. And this is the expected outcome. I want also to just give one information that the expected outcome are not the results of your proposal. So when you present a proposal, you will have to write the results that you will put on, that will be the in the proposal, but the results will impact the expected outcomes. So the expected outcome are, let's say, what your result can, how your result can help to reach this expected outcome of that the Commission identified. So what the proposal should cover in this under this topic? As you can see here, it's very stressed that all of the following elements should be included in a proposal answering these innovative non-animal human-based tools for biomedicine. As we say, so all the strategy that can be a good, better alternative to animal models. And for example, organoids, technologies that includes omics, high throughput procedures, but also in silico models. Of course, the proposal that are looking in the EU Commission should go beyond the state of the art. So in your proposal, you have also to explain how the results are going beyond what is already present, and not only at European level, but at a more research global level. And another very important aspect of this topic is that you have to prove that the new solution that you identified is better, so there is a cost-benefit assessment of the solution in comparison to the animal model. Also, of course, standardization is always a very good element, and here you have to provide it. Now, yeah, this is the scope and the expected. There is, I don't know here if we take the question now, but I think after the presentation, right?
Correct, afterwards.
Okay, thank you. Now the other proposal under tool. So I remember tool is the destination 5, so it's new technology, new tools for addressing some specific challenges. This here we are in the scope of regenerative medicine. There is this domain of health research that is regenerative medicine that tries to replace or generate new cells through 3D printing. There are still a lot of challenges in this field, and this topic wants to fund projects that are able to find a solution to the current challenges under a bioprinting of living cells. There is already a lot of work have been done in bioprinting of non-vital cells, but here it's really to go into the thick tissues, organs, so really using living cells. The idea is to fund a proposal that will give to the research community new units, bioprinting units for regenerating human tissue that will give results in order to have more availability of bioprinting tissue, both to academia and industry, that the healthcare professional have more information on these procedures, and of course that maybe these new technologies of bioprinting of living cells can even find solution to unmet needs that until now was not able to treat. Also, the bioprinting of living cells should also go towards what the European Commission is really pushing, and it's the personalized approach to medicine. Here under this topic, again, your proposal will have to present a solution that answer to most of these activities. And one, let's say, this is a must, the first one, so design the best bioprinting strategy for at least one type of tissue. And this is really should be one of the focus of the proposal. Of course, also some other of these these elements should be taken into account. So higher resolution of the bioconstructs, try to have a shorter timeline to the printing of biomaterials, also cover all steps of the printing suite, and even combining the different bioprinting technologies. So these are, you have always to see in the proposal where it states that you have to cover all or most of these activities. And so the European Commission expects that you propose a solution that meets these criteria. Now the next topic is under Destination 3. Destination 3 is tackling and reducing disease burden. This was also mentioned in the other destination, but here it's really to find a new solution for communicable and non-communicable disease, and to reduce the burden on the healthcare system. This is, as you know, with the COVID-19, we saw that infection disease are still a great threat for all human, and so the topics under this destination are focused on developing new vaccines, new candidate vaccines, and new therapies for prepare for a future threat on Earth. And this is in fact the key objective of this destination, is creating a more resilient, inclusive and democratic European society. Also, not only European, I would say, but all society. What is some of the expected impact under this destination is to reduce the health threat of antimicrobial resistant pathogens in the EU, which is one of the main point in the topic that we selected here, but also, of course, to reduce the premature mortality of people with the non-communicable disease. A very important topic under this destination is also mental health, well-being, and also other epidemic threats like tuberculosis, malaria, and other diseases. Let's go into the topic that has been selected for under this destination. So this is a single-stage proposal. So this means that as a single-stage topic, it means that proposal here will be should be ready to be submitted in April 2024. And the proposal is pandemic preparedness and the response host pathogen interaction of infectious disease. So this is really on being prepared to minimize the risk of a new outbreak of a pandemic outbreak or of other diseases that can be very dangerous for all the health system in the world. So what they want is to develop a better understanding of pathogen-host interaction and to target the development of vaccine and inhibitors. Here, the Commission is not only looking at development of vaccine, but also proposal can describe a candidate to vaccine or other strategy that will allow a quicker development of vaccine. So you see, in fact, there is also novel approach for the prevention and treatment of emerging and emerging infection, and vaccine candidates that inhibit cellular uptake of viruses. Also here, the Commission has stated that some of these elements should be taken into account in your proposal. There are some diseases, some virus that are indicated that are of main concern for the European Commission, but this is not, it's very good if you propose something that tackle these viruses, but you can also go beyond this list. So the important thing is so the characterization of the mechanism of the viral uptake, and in general, so to understand better how the virus is spread and how the virus can be, the threat can be reduced. It's very interesting that the Commission suggest here also to be in contact with the JRC, which is the research center of the European Commission, where they have a biotechnology laboratory that could be only, if the proposal is successful, could be involved to help you to reach the results of the proposal. Now we go to the last topic that I will present, and this is under another destination 4, which is ensuring access to innovative, sustainable, and high quality healthcare. And here it's really the destination that looks for access to healthcare for everybody in Europe and beyond. As we know, the health system in Europe, but also in other countries, are very advanced, but unfortunately the access to it is not always the same because of socioeconomic problem, because of vulnerable people, conditions, and other conditions that can be for example, in Europe, we have some immigrants because of the war and also all these problems. So the access to healthcare is not always the same. And this destination is really to look into how the new technologies and new tools and data can help everybody to have access to the same healthcare system. Yeah, these are the expected impact. In fact, equal access to high quality healthcare, and with the focus on improved evidence-based health policy. So this is what this means, that through the results of the project under this destination, the policy maker should have better evidence on how to help vulnerable people or people in special conditions to access healthcare. Also, under this destination, they are looking for technologies and tools that empower citizens in the management of their health, as well as the informal care. Now, let's go into the topic, and this is, in fact, the topic under care. This is a two-stage proposal. So this means that you have to submit the first proposal already this September. It's a reduced proposal, and this is really access to health and care for people in vulnerable situations. So this is to help people that have, for example, socioeconomic difficulties or have less digital literacy to access the new technologies for healthcare, but of course also to find a new way to reach these people that maybe have some limitation, like can be people in older women. We know that older women have less access to often less access to the healthcare because with less economic background, and this is really to look into all the people that can be in difficulties. For example, this proposal should address which are the barriers, and here we can think of people, also people with some disease that have then also as comorbidity, as other comorbidities, or also people with mental health. So which are all the type of barriers that can prevent people to access health. Can be, of course, migrants, and this will be also a focus of, I imagine, a lot of proposal under this topic. And the other topic to address under this call is which are the solutions that can bring more people to access healthcare system. And here, of course, in the European Union, we have a strong focus on prevention. So which are the which are the tools that can help everybody to access the screening and the prevention campaigns in member states, so that they don't develop the disease that then will be more problematic to treat. Better data as well, we said how we can get better data from this vulnerable population, and so that the policymaker can use this data and can provide more policy that are targeted to help people in vulnerable situations. And of course, cost analysis, cost analysis also for policymakers to understand how some policy can really benefit the people in vulnerable conditions in general. I think, yeah, this is all for the moment, and then I'm open to your question later when the other colleagues also have presented the other topics. Thank you.
Thank you so much, Francesca. And indeed, a lot of questions are coming in. Maybe before we continue, Francesca, just a couple of questions, immediate questions. We have a question from Myanmar, I think, asking if you could elaborate what therapies are involved under Destination 3. Does it also involve regeneration?
Under Destination, so we were talking about, let me check, the bioprinting of living cells. Yes, and this is really up to you to find that, not up to you, but you find that you have the problem which is stated in the topic, and your strategy has to solve the challenges that are still present. So if you think that this solution can bring a real benefit to this to the bioprinting of living cells, yes. So it's very important to take into account that the European Commission topics do not give the solution. So it's up to you to explain how your solution will benefit the challenge that is mentioned, how the results will impact the expected outcome. I repeat again, because when you see expected outcome, you think that you have to solve to reach all these, the results have to be the expected outcome. That is not, is how your results positively impact the expected outcome. Also, you can also mention in your proposal if there are where are the risks, if there can be negative effect in the strategy, that because I mean bioprinting of a living cell, it's also a topic with a lot of ethical issue. So you can also present potential negative effect. But of course, it's up to you to, if you are convinced that this solution is the right way, you can, of course, this is a very good idea.
Thank you so much, Francesca. And of course, a lot of our audience members are coming in with their specific research questions now. And as Francesca has said in her presentation at the very beginning, the funding and tender portal lists all the calls. So this is really just a very small segment. There are lots and lots of other opportunities. And as we said, we have a tutorial at the end of today's session where you will be receiving information how to access the funding portal, how to look for calls, and also then how to submit your proposal and how to find collaborators. So don't worry, we will cover all this. But at this point, first of all, thank you, Francesca. We are now turning our attention to more calls. And I've seen there's a question from a colleague, Dr. Siddiqui. He's waiting for a specific call, so don't worry, it is coming up. I'm inviting now our next speaker. Our next speaker is Zale Johnson, who is joining us from the UK, where she works as the National Contact Point and Global Innovation Lead Security at the National Funding Agency, the UK Research and Innovation UK agency. It's called UKRI. She will present to us forthcoming call in Horizon Europe Cluster 3, Civil Security for Society. So this call is due to open later this week, so it's a perfect time for Zale to join us now. Zale, the floor is yours.
Thank you, Suzanne. Thank you very much. I shall just find my, I hope everyone can see that. Thumbs
Yes.
up, Suzanne, if you can.
We can, it's perfect.
Perfect, right. Well, hello, everybody. I won't say good morning or good afternoon because I'm in the UK and it's morning, and I think most of you are in the afternoon. Yes, I work for UKRI. I'm the Civil Security for Society Cluster 3 NCP. And before I go any further, I'd like to first thank Suzanne and from EU-ASEAN for inviting me here today to present. It's really interesting because I work in Cluster 3, which doesn't really have a lot of health projects, but we do have one, and I'm going to be here today to talk to you about this particular core topic with regards health and resilience. So before we go any further, let's have a look at, this is what I call program on a page. This is the civil security work program on a page. It's for your aid memoir if you would like to look through it. The slides will all be available for you. The civil security falls under 6 destinations. The first destination is fighting crime and terrorism. The next one is effective border management. The third one is resilient infrastructure. The fourth is increased cybersecurity. Destination 5 is the disaster resilient society, the call that falls under this destination. And destination 6 is strengthen security through research and innovation. So we have a lot of interesting areas for people to participate in. And what I think is really interesting is that we're now including and asking people to join the security calls from different expertise and different thematic areas. So this is really exciting. So I'll move on. You will get the slide, so I don't really want to linger on this any longer. So the particular call I'm going to be talking to you about is improving social and societal preparedness for disaster response and health emergencies. The reference is there. And what I really want to go into is the participation criteria. I've noticed there's a lot of questions about, do I have to have partners? Actually, my areas of projects are purely collaborative. These are not mono beneficiaries. And just to give you some information about some of the security projects that were funded in 2021, for the UK, the average number of participants within a consortium was 17 partners. So that's sort of trying to emphasize that these are multi-collaborative, multi-expertise, multi-country projects. So let's have a look at what is the criteria for participation in this particular call. So it needs the active involvement as beneficiaries of at least 3 organisations from at least 3 different EU member states or associate countries. At least one organisation should be representing citizens or local communities. Another organisation should represent practitioners, that be first responders or second responders, and at least one organisation representing local or regional authorities. This topic also requires the effective contribution of social sciences and humanities. This is really, really important, as well as gender experts. This is because they want the project to produce work that is meaningful and significant and affects enhancing the societal impacts of the related research activities. And having those SSH experts in there, they can undertake that research, which means that it will be meaningful. Additionally, there is need for involvement of citizens, including citizen volunteers, and also civil society and other society stakeholders. These should be included also. And lastly, really, really highly encouraged is international cooperation. So as you can see, these are purely collaborative. Now, as you see, the second bullet says it's a research and innovation action, but what does this actually mean? There are three types of actions: research and innovation action, and coordination, support action. But this one is a research and innovation action. This means the research within the project should establish new knowledge, explore the feasibility of a new or improved technology, project, process, service, or solution. And this relates to basic and applied research. Again, I'm not going to go through all of this. This is for an aid memoir. You can read this at your leisure. But this is about research and then carrying that research into innovation. So it's all beyond, you know, it's really new and novel technology, process, project, or service. So let's get into the expected outcomes of this particular call. There are 9 expected outcomes. You can address some or all of them. So it's not, you don't have to do all of them, but whatever is specific to your area of expertise. So if we look at the first 2 bullets, the recent COVID-19 pandemic brought to the fore the real life challenges of health emergencies. It also highlighted how we need to be more prepared for future disruptive events. It's not just about having the right equipment and resources, but it's about being more prepared on a societal and society level. For example, protecting and supporting the vulnerable and tackling inequality at times of disaster. Currently, the support for different vulnerable groups is not equal, nor is it balanced, which in turn means that the critical information is not being effectively relayed to the right people at the right time during times of emergencies. This expected outcome requires research into improved ways of supporting and communicating with vulnerable groups and communities through more interconnectedness and by utilisation of these improved systems to prevent or reduce vulnerabilities. The second bullet looks at how to improve the health knowledge of people and their communities to help them better understand how medicines work and how these medicines or vaccines are produced. This will contribute to reducing disinformation during emergencies and increase trust and confidence of new products that need to be rapidly produced and administered, as we saw in the COVID outbreak. The next expected outcome is talking about how we can empower citizens. I think I might have missed one actually, bullet 4. So that's bullet 3, sorry, I beg your pardon. Bullet 3. So the next expected outcome is bullet 3, which requires research to improve communication during crisis events, thus providing communities with increased awareness and perceptions of risk. Challenges and limitations of communication strategies should be investigated to look at this expected outcome and ways to overcome barriers when communicating during crisis, including health crisis, including those that occur due to diversity within communities such as language and culture. It is suggested here that intersemiotics should be called upon to look at how some of these solutions could be address the challenge. For example, what type of technologies could we use to translate word to another form, such as sound, dance, music, or images, to ensure that we're including all those diverse people within the community. So bullet 4, this is about empowering citizens. It's about asking citizens to work within their own communities in times of crisis, whether that be a man-made crisis or a natural disaster. Empowering citizens is an effective form of resilience. By putting citizens at the heart of crisis management, protects against negative effects. And communities are more likely to put their trust in people that they know and are more likely to adopt new measures, such as new technologies and new processes or strategies introduced by those familiar to them. Bullet 5 is about information technology and digital data processing. This isn't a new concept, but it still has a long way to go and is being relied on upon more and more. However, large data sets pose problems of their own, and therefore being able to analyze data automatically to better understand, prevent and tackle health issues on a population level is critical to being able to make better decisions. This expected outcome requires research that not only looks at where and when it is relevant to use this type of technology during crisis management, but also to identify its limitations and where not to use this type of technology. Let's look at bullet 6, machine learning and artificial intelligence for decision making. This outcome calls upon researchers to investigate the ways in which AI, artificial intelligence, and machine learning can be used at critical events, and when to use them, how to use them, and why they should be used, and once again identify the limitations of such technology. This means that experts across this field should be gathered to have effective dialogue about these challenges and potential solutions. Additionally, it should be recognised who should be responsible and what their competencies should be. In other words, what skills, knowledge, experience and ability should they have to actually carry out this decision making. This is more about, getting those people together. So this part of the core topic is about getting people together and talking within a workshop or within a forum to thrash out some of these really important details when it comes to artificial intelligence for decision making. Then we're looking at bullet 7, the wearable diagnostic technologies. Wearable technologies, how can these be deployed and used in the field, at site, to quickly tackle crisis events? How can our first and second responders use these successfully and confidently? Research projects that are going to tackle this bullet should look into the feasibility of such technology actually in situ, and also taking into consideration the future and climate change. We know that diagnostic appliances turn themselves off at a certain heat. How can we prevent that to happen in site and in field? Okay, so here we go. Bullet 8, enhancing and optimizing the One Health principle. This expected outcome reinforces the One Health principle, which is an integrated, unifying approach to balance and optimize the health of people, animals, and the environment. According to the One Health approach, health of humans, animals, and environments are intertwined. This is illustrated by the health crisis in which COVID-19 was attributed to SARS, which meant that it jumped from wild animals to humans. Another illustration of One Health interconnectedness are health impacts of climate change, which I mentioned previously. These interdependencies make an interdisciplinary approach to health necessary that incorporates all aspects of health and their interconnectivity. So let's look at bullet 9. This is the last bullet. This is about ethics, privacy, and protection of rights and personal data. I did mention that the expected outcomes, you can undertake some or all of these, but for this one, this is for all projects. This should be taken on for every single project, because the project should comply with privacy safeguards, ensure that disaster response systems protect EU fundamental rights, and include privacy and protection of personal data. This is the one bullet that actually all projects should incorporate. So I've whizzed through that really quickly. However, thank you for your attention. And if you require further information, please do contact me. And thank you very much for listening.
Thank you so much, Zeel, for this comprehensive information also on this opportunity. And just a little reminder to everyone, we are just presenting to you a very small number of opportunities in the current Horizon Europe work program. So we will have a video at the end today where we will introduce you to the funding and tender portal where you find all forthcoming and also closed calls. So I know that a lot of you have very specific research backgrounds and research interests, and I'm sure there'll be information also for you. Now, Zeel, thank you so much. And before Jenny will moderate the Q&A session, because the questions are coming in, I'd like to introduce you to our third speaker of this session. It's our third national contact point who joins us from the Netherlands. His name is Ahmed Polat, and he works with the Netherlands Enterprise Agency. He is an expert on calls in Horizon Europe Cluster 4, which deals with digital industry and space. So he has prepared information also on 2 forthcoming calls for us. Ahmed, the floor is yours.
Thank you very much, Susanna. I will share my screen. Let's see if it works. Yes, it does, I guess. Good morning or good afternoon in Asia, or good evening, I guess. My name is Ahmed Polat. I'm working for the Netherlands Enterprise Agency. That's a Dutch organization. Just a brief introduction, what we do. A little bit promotion for my organization. We're a part of the Ministry of Economic Affairs and Climate Change and Climate Policy. And we have various partners, and one of them is international, where I work. We are quite huge organizations, more than 6,000 employees. And we make sure that about 6.3 billion euros is shared with the universities, with the companies, and also local authorities. And we are more or less the gate for giving away that amount of money. Now, for the Horizon Europe, I am coming from 2020, so I have some okay, Horizon Europe. What I'm going to talk about is about Cluster 4. Cluster 4 is for digital space industries and industries, and my job is to explain you 2 calls to Horizon CL4 resilience, biodegradable polymers for sustainable packaging, and advanced biomaterials for the healthcare. I've made slides as easy as readable in diagrams, because I find it quite easier to digest. Biodegradable polymers for sustainable packaging materials is an innovation action. Zeel explained about what the innovation action means. At the end, I will tell you what the TRL levels of innovation actions are. So in a way, this is not a research and actions, it's not a CSA, it's an innovation actions. It's quite a higher TRL level than the other calls. The main goal of this call is transformation of the packaging industry into sustainable practices and materials. And there are 3 focus areas that this call is focusing on: is a biodegradable polymer materials, circularity by design, and standards for biodegradability. In the following slides, the expected outcome 1 is the access to biodegradable and recyclable materials. As you can see, the packaging industry and plastic materials producers and transition officers are the main 3 pillars of this expected outcome. What is needed for the packaging industry is that it has to have the access to next generation biodegradable polymer materials who are also recyclable. That's also the basic idea. But to make that happen, you need the plastic materials producers, and from their perspective, it is very important that the shift is going to take place from PP, PE, and PT into biodegradable materials who are able to reduce the greenhouse gas emissions. That's the goal for expected outcome 1. And the transition of us is that the sustainable alternatives are for and with comparable scalability. That means that the technology that you're going to offer in this proposal of the project will be same comparable scalability and improved end-of-life characteristics. That's expected outcome number 1. And we have other 2 expected outcomes. And this one is about the circularity by design and sustainable end-of-life solutions. As you can see, you have in your proposal, you have to address the circularity by design, sustainable end-of-life solutions who are applied to plastic packaging materials, aims to reduce landfill waste volume, mitigate littering of plastics, especially that's a huge problem in all of the world. Aligning, that's the very important part, aligning with Horizon Europe Ocean and Waters mission. Look at those missions and the funding programs and other projects. Contribute to the plastic strategy and contribute to the single-use plastic directive and contribute to the EU Circular Economy Action Plan. So you have to address them in your proposal in some way to see whether your project or proposal is aligned or contribute to those strategies and plans. The third expected outcome is define standards and labels for biodegradability. That means you have to develop testing methods for biodegradability to enable standards and labels for specific applications, enhance transparency, enhance credibility, and enhance consumer confidence. Those are very important issues that you have addressed in your proposal. And in this particular expected outcome is so to enable contribution to GHG emissions. You have to make it clear what your project or proposal is going to contribute to the goals of the European Commission and the world. And of course, promote advancements in sustainable packaging. All these elements has to be addressed in your proposal. For scope, there are 7 issues that has been listed. 4 of them should be listed in your, at least 4 should be listed in your proposal. One of them is the develop and scale up advanced biodegradable polymer materials, as discussed above in the expected outcomes. Create sustainable additive and catalysis supporting biodegradable polymer production. Conduct life cycle and techno-economic assessments to ensure cost competitiveness, that is enabling or quantifying what it means. Developing circular business models, including GHG emissions, and utilizing secondary raw materials. Demonstrate complete biodegradability and assess environmental impacts. Test and analyze biodegradability pathways in relevant environmental conditions and scale up pilot production of packaging materials. These are the scope of this particular goal. In the following, in this slide, you see what the constraints are you have to use for in order to advance the developments, use digital tools for modeling, simulation, and advanced characterization techniques. And that's very important, especially with the technology that we have now, the artificial intelligence, machine learning, etc. You have to employ those techniques in order to fasten the development of these technologies. You have to look for collaboration with existing projects, whether it is national or international or funded or is still in progress. Make sure that you look for projects or programs that has been funded, and look for to cooperate with them for added value. Collaboration for open innovation testbeds, especially for Europe, it's quite important. We have many testbeds in Europe, and you have to look for cooperation with them and collaboration. Similar with existing projects, relevant initiatives in Europe or worldwide should be looked for, and look for collaboration. As mentioned before by other speakers, social societies and humanities is a very important element of these projects, because they are very much integrated with society, with the citizens, and you have to look for involvement of SSH and other experts from that domain. And of course, because we are dealing with packaging industries, early engagements of the end users, especially the consumers. The requirements of this particular goal is projects should start at TRL 4, as mentioned before. These are innovation actions goals, so higher level TRLs, and aims to achieve TRL 6 or 7 of the by the end of the project. So you have to look for project that really is more or less ready to take the next step for taking in the market. You have to consider a future Commission initiative for safe and sustainable by design. That's very important. We are very much focusing from Europe to safe and sustainable by design. It's just, it is not a fashion word, nor jargon. It is really an issue that not only on European level, but also in local or member states itself are focusing on that particular area. And these two last 2 points include a robust business case, because that's very important. Innovation actions are looking for a business case. You have to take care of that. You have to explain what it does and how it will contribute to the society as such. And you have to include the exploitation strategy. That's also a part of the innovation action goals. You have to look for both of them in your proposal. The following one is the advanced biomaterials for the healthcare. By the way, at the end of after this, you can ask many questions. So I'm going quite fast through those slides, so you have at least some information what we have to talk about. Advanced materials for other advanced biomaterials for the healthcare. It's also an innovation action. I'm going to discuss the 4 issues: expected outcomes, scope, digital tools, and project requirements. The expected outcomes, as is outlined in the description of the topic, as you say, the projects will contribute to the innovation market of medical applications and depend on advanced biomaterials, biocompatible materials. And the main goal is the development of 3D printable and injectable biomaterials, including for the materials with shape-changing properties. As you can see, 4D shape is coming back several times in the description of the goal. Drive breakthrough in medical treatments, offer improved deliverability, offer precise implementation, offer controlled release of therapeutic agents, offer antimicrobial properties, and offer ability to monitor and stimulate biological events. That's outcome 1. And we have some outcome 2. Injectable materials for non-invasive surgical procedures, as you can see, is quite complicated diagram. The goal is medical and surgical properties and use of injectable materials for, as explained before, for non-invasive surgical approach, provide easy deliverability, increase implantation precision, provide therapeutic agent release control, provide antimicrobial properties, and provide monitoring and stimulating biological events. To make that happen, you need medical suppliers, as you can see, and medical suppliers should have the hydrogels, including nanocomposites, the materials and synthetic polymer-based materials, bone cements, bioceramics, and electronics. They have all included in the expected outcomes, and they have to be commercialized to benefit the medical and surgical procedures. So you have to look for those issues in your proposal to make sure that it is included in your project proposal. Now we have again 7 scope issues that has to be addressed. At least 4 of them is utilize digital tools, develop 4D materials, employ engineering strategies, address antimicrobial resistance, scale up production is very important, design for circularity as explained, outlined before, and ensure safe and sustainable by design. Those are the 7 issues, and you have to look for 4 of them, select 4 of them. And again, the collaborative approach, existing projects, collaboration, relevant initiatives, collaboration, funding process, collaboration, involvement, again, age disciplines, experts, institutions, and involvement end users. Those have to be addressed in your proposal. And at the end, again, in this case, the project should start at TRL 3 for just end of research and innovation action, the start of the innovation action, and achieve 5 or 6 at the end of the project. Again, consider circular economic action plan from the European Union, EU chemical strategy, include robust, and again, this is an innovation action. You have to include a robust business case and an exploitation strategy to make clear what this project will contribute to society at the end. Thank you. If there are questions, you can ask.
Thank you so much, Ahmed. Let me just join you on screen. Here I am. So thank you so much for that very comprehensive presentation. I'd like to bring in as well Zale, so we can go, and also, of course, Francesca on the screen, so we can go to the questions. We have a lot of questions here, some more general than others, and perhaps I can start with something very basic. As you can probably deduce, the understanding, the comprehension levels vary. There are some who actually know already about Horizon Europe, and there are those who are listening to the Pillar 2 calls for the very first time. So perhaps, Francesca, if you don't mind, you can take on the first question about the EU portal. So how do they submit their proposal, and how do they maximize the use of the EU portal?
Yes, thank you again, and also thanks to Zell and Hame to cover some of these specific information on the submission of the proposal. Indeed, we are under Pillar 2, so they are all collaborative proposals. So as this organization, the ASEAN country, will be in generally partners in a consortium, the organization that takes most of the responsibility to submit in the portal is the coordinator. So you have an organization which is in general in the European Union who takes the roles of coordinators and will help you in adding your organization in the portal of the European Commission, and you will have already to provide some information about your organization and to be validated in this system. So the first thing is to find the consortium, so find the right partner to decide which is the topics you are interested in. And then from there, look for how to act. It's a very simple website portal, but you have to be used to it so that you are not at the last moment. And in this portal, you can search. You can search for different funding opportunities. So there are the different programs. We are talking about the Horizon Europe. So you can select Horizon Europe, and then you can put some words, keywords, which will give you the results of the topics that are we have these keywords in their topics. Of course, be careful because the portal provides all the topics, open, closed, and forthcoming. So you will be interested only in open and forthcoming. The closed, you are less interested, but this is another topic. And also in the participant portal, you can check. There are also information about other partners looking for finding a consortium in a specific topic. So you can use also for this. And in general, on the website of the European Commission, so not only the funding participant portal, but there is the website. But I think the tutorial will address this, where you can find all the information. There are tutorials on the participant portal. There are tutorials on the topics. But this, I think, then you can cover with the tutorial later.
Thank you so much, Francesca. So I guess, it's very important for us to spend time on this funding and tenders portal, spend maybe like some minutes of your day just getting to know how the system works. It's in our experience, it's quite good, to navigate. It's quite easy to navigate. And as scientists and researchers, we are very used to, finding things, so just make sure that you put the query, the words that you want to find so that you can also look at the proposal. But I'd like to also take from what you discussed, Francesca, earlier about finding partners, because you said that you need to find a partner in Europe. Perhaps Zale, you can give us some tips on how to find the right partner.
Okay, you're absolutely right. You do need to spend some time on the funding and tenders portal. You need to be really familiar with it. Because if you are, then you will get the best out of it. Also, in addition to what Francesca has mentioned, you also need to get yourself a participant identification code, a PIC, because unless you get one of those, nobody can see who you are. So if you get one of those, you can write down everything about yourself, who your organization is, who your expertise is. So it's not about you looking for partners, it's about people finding you as well. So it's really important to do that. Now, there are many ways to find partners, and I don't have an hour to do this, but on the funding and tenders portal, you can search for partners by the actual project. So at the top navigation bar, there is an area, a drop down that says partner search. Sometimes if you're too specific with your wording, you perhaps won't get the right response. So what I would say is try and look for go through the work programs first and find the particular call that you like, and then look for partners. So there's that way of doing it. There is word search as well, but and also you can go through your NCPs. I don't know if all the ASEAN countries have NCPs. I'm sorry if I don't know that, but you can also call upon your NCPs to help you as well, because their remit is to assist you to participate and to participate successfully.
Thank you so much for that, Zale. And that's a very good point about those NCPs that are assigned to the region. We will try, Susanna and I will try to compile this list of NCPs, and perhaps in a follow-up email, we'll send you, their contacts, and hopefully you can get their advices as well in the same way as these excellent NCPs that are joining us from Europe. Zale, if you don't mind, I'll stick with you for one more question, because we always get this question in the Horizon Europe calls.
Oh, I know what you're going to ask me.
Yes, I know you know that this is coming, Zail. So you know about the UK's participation in Horizon Europe. Could you please explain that a little bit to us?
Oh, right.
Can they participate? Yes, thank you.
Okay. At this moment in time, I'll try and be really succinct. At this moment in time, UK and the Commission are consulting. Now, there was a hiccup, and the hiccup was the Northern Ireland Protocol. That hiccup has now gone away, and with the Windsor Agreement, which was done in 3 months, that's not there anymore. So we're now in consultation with the EU Commission. We're thrashing out some of the terms and conditions because 2 years has already gone past. And so therefore it's our contribution and our participation changes. However, at this moment in time, while consultation is ongoing, the UK can participate as an associate country. And that means there's no change. The only change is that by the time the grant agreement needs to be signed, if we have not associated, then we participate as a third country. That doesn't mean very negative. It just means you can't run the consortium. You can still be technical lead, you can still be work package lead, but I am still encouraging all UK participants, all UK interested parties to just participate and you know, get involved in projects and proposals as they did before, because there's no change right now as we speak. However, if we haven't associated, then UK participants get their funding from UK government and not from the Commission, but that's just something else. But I hope I've described that easily enough.
Thank you.
For giving me that.
I think it gives us an idea already. I mean, that the most important thing is, you know, the UK is participating in Horizon Europe. And so, you know, if you have partners, and I'm sure many of the people here have partners with institutions, so we are encouraging you to still continue this collaboration.
Absolutely. Thank you.
Thank you so much. Ahmed, I'll go to you. As you can see in the chat, there are some specific questions on specific calls or specific research that they want to do. But I guess the question is, you know, how will they make sure that, you know, how can they find out if the research that they are doing is actually covered or will be covered, apart from, you know, looking at the funding and tenders portal? Can you give us some tips on maybe getting an idea on what to expect?
Yeah, I have seen a question about whether their ID fits within the goal. That might be, but the fact is, as Zail explained, these are huge projects, and you have to look for many partners from many countries, member states, and maybe Asia. So you have to look for a consortium that will bring the ID, the solution to the market or further. So you can have a good idea about what you can contribute to for the goal or the project, but you have to look for solutions with partners all over Europe. And so my suggestion would be look for partners in Europe that are planning to develop a proposal, and make sure that you are a part of the proposal. And you can contribute with knowledge, with your products, with the end user involvement, or whatever that you can bring to the table, and make sure that you are adding value to the project, the proposal. As mentioned earlier, you can do that. You can propose your ID via the portal, via the NCPs, or I don't know. There are also various events you can participate and talk to the people, and look for companies and organizations that have already been in the in the process before who participated in projects and proposals and funded companies and organizations who have been successful in coordinating and leading projects, and talk to them and make sure that you can be a part of those new developed projects and programs. Because in that case, you get to know the European Horizon Europe, the process, how to deal with it, the writing, all those aspects, and then you can go on and experience for the next calls and proposals. But it is quite unlikely to assume that when you have an idea, that your idea will be taken over by other organizations and companies in Europe. And make sure that your idea is a part of a more huge idea, some of ideas that can contribute to the expected outcomes as is outlined in the description of the topic.
Excellent points. Thank you so much, Amit. I'd like to bring the discussion to the participation of, not the usual, we usually expect, research institutions and universities to become involved in Horizon Europe. What about businesses, maybe non-profits, as well as SMEs? Can they participate in Horizon Europe? Any one of you, please, could jump in.
Yes, indeed. Everybody can participate. Everybody can put its own part. And actually, the European Commission, as you can see, as also my colleague said, the approach of all these projects should be interdisciplinary. So, and has to impact as many parts of the civil society as possible. So NGOs, in health, of course, patient organization, there is a lot of stress on co-creation of solution with patients, with the carers, with the health professional, of course. And there is, if you see when you will read the topics of proposal, SME participation is always stressed, and because it's another main aim of the European Commission to foster research in SME and to make them stronger and more resilient. So the more SME, is participating in research, the better can be prepared for the future challenges. So see, yes, every type, also public administrations and cities can participate in Horizon Europe. So it's really, there is even individual, of course, it's a little bit more difficult, but also individual can participate. So it's really open to everybody. Everybody is welcome. The more interdisciplinary and the more different are the stakeholders, the consortium can better define a solution.
Thank you so much for that, Francesca. Unfortunately, we are running out of time. We still have one important part, which is really the consortiums that have been built, with us, especially with ASEAN participation. So I'm sure everybody is excited about that, because then it gives us an idea, and it gives us also the inspiration, to join this consortium. But before I do that, I would really like to thank you, Francesca, Zail, and Ahmet, all of you great NCPs in Europe. We hope that we can keep in touch with you, because definitely this is exciting, but it's for us here in ASEAN, it's also a little bit daunting. So we really need the help of our European colleagues. So thank you for sharing the time with us. We'll put you back a little bit because, of course, you have a lot of things to do, and I'll bring back my colleague Susan to bring us to the next part of the program.
Thank you.
Thank you.
Thank you so much, Jenny. Thank you so much to all our speakers, and thank you also to all the attendees. We know this is a long session. We're really grateful that you are joining us. And before we continue, I just want to very quickly remind you of what's happening next, because we heard that, of course, you're particularly interested in learning how to build a consortium or join a consortium. So first of all, we will share the recording of today's session and all the presentation slides with you in the next couple of days. We've also created a survey. This is the QR code for the survey. In the survey, we want to collect feedback from you, which calls you are specifically interested in, and also what you think you could bring to the table. Because our wonderful NCPs have already indicated they might be able to help us a little bit in getting you connected to potential collaborators in Europe. So don't fill this in tonight. Give it some time to think about, so that you can present yourself and your possible contribution to a consortium in the best way possible. And we hope that Jenny and I can perhaps be the bridge function and help you get ahead with this. So we are now looking at a really exciting part of today's event, because we know that this aspect of reaching out to European collaborators is probably the most daunting. It's also the most important. So we have invited 3 fantastic speakers who will share with us some information on how to start collaboration with European partners and how to hopefully join a Horizon Europe Research Consortium. The 3 speakers today are joining us from Indonesia, Professor Ari Probandari. From Thailand, we have Professor Aruni Titi Sainyanot, and sharing his time between Thailand and Norway is Dr. Hans-Jürgen Overgaard. And I'm not going to say too much about the projects that they're involved in, because we invited them to share a little bit. But let me introduce them to you. Our first speaker is joining us from Indonesia. It's Professor Ari Probandi. She's a medical doctor with specific training and expertise in public health. Her research focuses on implementation research of disease control programs, program evaluation and health systems. She currently serves as the head of the public health doctoral study program at the Faculty of Medicine at Sebelas Maret University. And she's also a researcher at the Center for Tropical Medicine at the Faculty of Medicine, Public Health and Nursing at Gadjah Mada University in Yogyakarta. Beautiful. She is involved in the Horizon Europe project that deals vaguely, I think, with diabetes and hypertension prevention, but she's here to tell us a little bit about that project. Professor Probandi, the floor is yours.
Thank you very much, Susan. Let me share my screen. So thank you very much for the committee that invited me in these prestigious occasions. So let me introduce our current ongoing project that funded by European Union Horizon 2020 project grant. The project's entitled Scaling Up Non-Communicable Disease Intervention in Southeast Asia, shortened by SANISI project. It is a collaborative project between several institutions in Europe and also in Indonesia, Vietnam, and Cambodia. So this is basically our consortium member. I'm coming from Universitas 11 Maret in Indonesia. We have the University Medical Center Groningen, Netherlands as the coordinator. And we have other institutions in Europe that's also actively involved as the consortium member, which are University of Groningen, Netherlands, University of Passau, Germany, Trava University in Slovakia Republic, and we have HAPICH in the UK and also HAPICH Internationals. In the Southeast Asia, we have the other 2 institutions, which is Thai Nguyen University, that's in Vietnam, and Health Strategy and Policy Institute in Vietnam. The HAPICH also help us with the implementation of the project in Myanmar. So basically, SANISI project is the first research initiative that working on the issue of scaling up of non-communicable disease interventions with the implementation of a rigorous impact assessment around the community level health program. So we are working in the 3 countries, and I'm serving as a country coordinator for Indonesia. So we start this project because of the the issues of increase of non-communicable disease prevalence, particularly in the Southeast Asia, we particularly interest in the problem of diabetes mellitus and hypertension. And our project question basically would like to scaling up the prevention and control program of non-communicable disease in diabetes mellitus and hypertension. We have several questions like what have been done in relation to the diabetes mellitus and hypertension control, prevention and control, and also what's interventions that cost effective, and what can be improved at the national level. This is the three questions that we particularly work during the SANISI project. So this is the aim of the objective of the project. We aim for the increased effectiveness of intervention of NCD prevention. We analyze the factors affecting NCDs and develop models to improve the effective program. And then we also recommend the cost-effective intervention. We particularly evaluate the program that have been carried out. And also then we improve that kind of program to be a cost-effective NCD prevention model. And we provide recommendation for effective NCD prevention model that applied in other regions or countries in the Southeast Asia. So we particularly use this kind of framework. We try to look for the impact of synergies between the community-based activities and the primary health services in relation to the non-communicable disease prevention. So in Vietnam, in Indonesia, and Myanmar, we have the primary healthcare system. In Indonesia, for instance, we have Puskesmas as the unit of the primary healthcare that responsible for early diagnosis and giving medical treatment. We also have the community-based activities. In Indonesia, we have Posbindu, for instance, which is the focus of our intervention. The Posbindu particularly work for screening the diabetes and hypertension in the community. But we would like to improve that kind of program by strengthening the screening in the community, as well as the improving of linkage between community-based activity with the primary healthcare services. So the project is 4 years study. We have been through a COVID-19 pandemic period, so it was a struggle as well to implement this project. But fortunately, we can finish that by this month, June 2023. So in the project, we have several phases of the project implementation. First, we have the initial assessment. We call it retrospective phase of the study. We basically look for the existing intervention and then assess the effectiveness of that, assess the gap and also the challenges of the implementations. And afterwards, we develop the model for improving the implementation and then doing the intervention in the prospective phase of the study, and then looking for the effect of that intervention. So in Indonesia, the SANISI project working in the 4 cities and district. So we have Batang Regency and Kediri City as the intervention area, and Surakarta City and Jember Regency in the both in the Central Java and East Java province for the control. So we also have a kind of cluster of people that be selected of primary care and workplace or school. So this is basically the framework that we use for the intervention. We have a multifaceted intervention to improve the implementation of the NCD non-communicable disease program in Indonesia. So after we assessing the current gap, then we develop the model of intervention. We particularly interest to improve the screening of the risk factor in the post window. And we have also tried to improve the linkage between the community-based intervention activities in the post window with the existing program in the primary care. And after that, we have also some intervention related to the, for instance, development of the cadre algorithm, because for the screening, even though we have already the guideline for the screening, but it was perceived not to be practical by the cadre. So we help with the development of the cadre algorithm, training of the community cadre. And after that, we also have some kind of other intervention like development of the health education materials that used by the cadre to educate the community, and also training for primary healthcare officials. And we also try to extend the integrated post-bindu into workplace and school. And finally, we create the policy brief and advocacy meeting with the stakeholders. It is because in the first phase of the study, we identified the problem about missing men and younger people to be screened for diabetes and hypertension with the existing post-bindu program. So this is basically the intervention that we do in the Sanisi project in Indonesia. This is some illustration about the activities of the post-bindu. So in Indonesia, the government already put post-bindu as the screening program in the community. But like what we have found in the initial phase of assessment, even though there is a national guideline, but the cadre need more operational tools for conducting the screening in their level. So we developed the cadre algorithm to screen the people with low risk, moderate risk, and high risk of diabetes and hypertension that has been used by the cadre. And also the cadre try to educate the community about the importance of screening of diabetes and hypertension. So the algorithm that was trained for the community cadres and also the primary healthcare staff, because we would like to build the linkage between the post-bindu and the primary healthcare staff. And we also create the workplace post-bindu as an extension of the post-bindu, because in the initial assessment, we also found the phenomenon of missing men and younger people. That's particularly because of the post-bindu is usually conducted in the working hours. So for men, they are busy with their job, so could not be screened in the post-bindu. And also for people in the school age, I think that's also have the similar barrier. So that's we extend the post-bindu into workplace setting. So we are now still in the analysis of the result, the findings that will be formally shared with and reported to the Horizon 2020 Grant Committee. And I think what I would like to emphasize by doing this multi-partners project in the Sanisi project, actually we have, I call it multiplier effects. So we have experience with the multi-years research, but also actually the Sanisi project give us the opportunity for more benefit because of the other activities beyond the project, like exchange students, visiting lectures, joint publication, joint grant writing, and also workshop and capacity building. So I think this is also a benefit for doing the project under Horizon 2020, because we basically with the multi-years project, we can expand the collaboration in more activities that strengthen our institution and also our networking. So that's all. Looking forward for the questions and discussion. Thank you very much.
Thank you so much, Professor Propandari. Before we go into the questions, because of course we'd like to find out how you and your institution got involved in this project, let us just briefly also hear from our other two speakers, just a very brief overview of the project that they're involved in. And I know that our next speaker, Hans Overgaard, is on a train somewhere, so I think also his colleague is here. Just a quick introduction. Hans Overgaard is a medical entomologist and he's professor at Khun Khan University in Thailand. He's also a research scientist at the Norwegian University of Life Sciences called NMBU. He has studied the ecology and behaviors of malaria and dengue vectors on 3 continents, including insecticide resistance patterns and options for vector control. He is currently leading a Horizon Europe project on pandemic preparedness, so very, very timely issue, to understand pathogen spillover processes between wild and domestic animal hosts, intervertebrates, and humans. So Hans, if you are able to join us, but perhaps you can also introduce us to your colleague, who I think is also part of the session. Hans, the floor is yours.
Thank you. Can you hear me?
We can, yes.
Can you hear me? Yes, okay, very good. I'm on a train between Stockholm and Oslo, so I'm arriving in Oslo maybe not so long, so I'm not sure how long time I will join, but I will be able to make a presentation, I hope. And if there are any questions, my colleague Mohammed Gawad, who's the project manager of the project, can maybe jump in and answer any questions. So Mo, say hello, Mo.
Hello, nice meeting you all. My name is Mohammed Gawad. I work here with Hans. I'm very looking forward to seeing you all in our discussion. Thank you.
So now I also hope that the internet connection works fine. I'm trying to share my video, and I'm not really sure how to do that. So
Hans, I can share your slides if you want. You send them to me. I have them here.
Yeah, I changed them a little bit, but that could be fine. Let's see. Oh, share screen. No, I think I would prefer to share my.
Okay, please share yours. Please.
It should be this
one. Okay, perfect. We can see it now. If you go on full screen, then we can see the slides.
It's hard to manage. I'm sorry for taking the time. So, full screen. Oh. There we are. Does that work?
It works. Please continue.
Okay, so the Pandasia project is really to understand zoonotic spillover pathways for pandemic preparedness. And I'm not going to talk so much about the project maybe, but I can do that. But I wanted also to explain the process that we had to develop this project, and a little bit about the background and what is required from my side, from our side. So just shortly, the Pandasia project is we got not really 3.7 million, but 3.4, 3.5. It started just this year in January, so we're just in the beginning. We don't have any results yet. We're just trying to establish project collaboration, and there is more information on that link there. So this is a collaboration between 4 partners in let me see now. There are 4 partners in Thailand. So all the field work will be done in Thailand. Collaboration is with Khun Khan University, Chulalongkorn University, Mahidol University, and a company called Supa 71. And then we have 6 collaborators in Europe. 2 are in Norway, so my university, the Norwegian University of Life Sciences, the Veterinary Institute in Norway, and then also Heidelberg University, Heidelberg University in Germany, and the Institute for Wildlife and Zoology in Berlin, and Umeå University in Sweden. So the aims of the project is to improve the understanding of the drivers of the emerging infectious disease pathogens with a focus on viruses, really, and to understand the spillover dynamics from wild animals to domestic animals and to humans, and the interactions then that drives these processes in the environment and animals and human social science domains. And then also to provide healthcare providers a better evidence base, tools for more effective public health countermeasures. So it's really 2 parts that were sort of part of the call itself in 2022. So we applied for this project in April 2022. It forms a natural dual idea of having systems analysis, really to understand what's going on in the field, people living in villages, how often they go into the forest, what kind of animals they get in contact with, and also the viruses that circulate in people, in animals like bats and rats and wild boar, and then we're looking into the actual virology as well. And so that would be the systems analysis of the project, but we also have intervention. So we just systems analysis really to understand what's going on, and the intervention is then to do something about it and to get an early intervention at upstream spillover locations and situations. I think that was partly why we were successful in getting this project funded. So just a little bit about my background. So if you start from below, my master's degree, Master of Science in Forestry, and I did a year for forestry and entomology studies in Yale, where I really tried to focus on environment and malaria mosquitoes. And I did my PhD work at the Swedish University of Agricultural Sciences, Uppsala, where most of the field work was done in northern Thailand. And since that time, I've really been more or less based in different institutions. For example, the International Water Management Institute, which was at that time based at Kasetsop University in Bangkok, where I did my postdoc. And then I continued at the Research Institute in Norway. We also did research in the region, in Thailand, Vietnam, Sri Lanka as well. I did 1 year stint as a medical entomology officer in Equatorial Guinea in Africa, and then came back to Thailand. Been working with the Institute of Research and Development, French research organization at Kasetsop University in Bangkok as well, whereas leading projects on malaria and mosquito control. And really all this time I've been really based at the Norwegian University of Life Sciences, where I've been a researcher and project leader, doing many projects on malaria, mosquitoes and dengue mosquitoes, especially in Thailand, but also in Myanmar. We tried to make a project as well that got stopped by the pandemic in the military coup there. And I'm also currently visiting professor at Konkan University in Northeast Thailand. And here are some of the locations where I've been working. So that I really wanted to show that I've been I know the region quite well. So I think that is setting the scene for being able to apply for a project with collaborators in Thailand and Laos. So we have another sister project which is also done it down. But the EU project is set in 2 provinces in Thailand. And just to show the background, what really happened when we started the planning of this project. So it's really started in 2021, where we didn't really have, we just wanted to do a new project, and we thought we were all sort of affected by the pandemic, and we thought this was really interesting to look at how these pandemics start. And then we didn't know about the EU call at that time in June 2021. So we had several meetings with Ken University, tried to do background analysis and inviting partners, we had regular meetings and tried to set the problems, the research questions and objectives and so on. And then we found out later there was a suitable EU call around September. And then we really started focusing on this call, writing the proposal and also inviting new partners. We started quite early to have bi-weekly meetings, which I think is really important to meet regularly because we are all in different locations, Europe, Thailand. And so the focus then was to look at the call, and really, you really have to be very sure that you're answering the questions, the outcomes that is shown in the call topic, and the expected impacts. You really have to address them directly in the proposal. And the pathway to impact, I will show that on the next slide. So the deadline of the Horizon was 21st of April, maybe 1 hour before. So there was a nervous time, and then a few months later, August, we got the results. We were lucky to get this project. And for me, this is my first time. I applied for EU, and I think it was a mixture between being lucky and also being in the right spot, having the right project at the right time, but also the way we constructed the project was.
Hans, I'm sorry, we're having a little trouble hearing you. I think you might be breaking up, but I think we perhaps maybe we ask Mohammed to also come in a second. I think we got the main part. If you don't mind, perhaps if we ask our third speaker first to share a little bit about her project, and then we'll get you back in, Hans and Mohammed, to talk about when we're answering the questions. I hope that's okay with you. I'm sorry, the connection is a bit bad that we can't hear you very well. But allow me to.
You still can't hear me. You cannot hear me now.
We can hear you now. Sorry, but it's breaking up a little bit.
Okay.
If you allow me, we quickly ask our third speaker, Professor Arunil Titi Sayanot, from the Faculty of Science at Mahidol University, also in Thailand, to perhaps share a little bit about the Verdi project where she is involved. Professor Aruni is a leading figure in pediatric infectious diseases and virology, and her involvement in the Verdi project, which started last year, underscores also her commitment to tackling new SARS-CoV variants affecting pregnant women, children, and high-risk populations. So Professor Aruni, if you could give us a little bit of an introduction to the Verdi project that you are participating in. Thank you so much.
Okay, thank you very much. I will go very short. Okay, actually the Verdi project starts with a group called Penta. I think the head of Penta Foundation is in Italy. Okay, but among Penta Foundation, they create a lot of global pediatric research network, and also Penta Infectious Disease Network, which already found well established for a long time, like 20-30 years. So that is what it starts. But because during the SARS-CoV-2 outbreak, the COVID outbreak, there are emergency requests for proposal in April 2021 from the European Commission, and they aim to fund 30 million. So altogether, 3 big projects, large projects get funding, and we are part of that. This Verdi get funding from SARS-CoV-2 variant evaluation in pregnancy and pediatric cohorts. And you can see that we got so many partners all over the world. Thailand have 2 sites, but altogether we got 22 partners all over the world. And you can see most of them are university, academic institutes. And in Thailand, we have Mahidol University and Chiang Mai University that joined this project. You can see as the project objective, actually we want to track and characterize variants of concerns of SARS-CoV-2. And the rationale behind that is because we believe that pregnant women and children are vulnerable group. And at that time, like vaccine and antiviral is not like that apply all over the world like this. So at that time, we believe that maybe those groups are the group that would be not covered by vaccine and antiviral. And we think that those groups may be one of the group that might affected by the virus and also might be the reservoir for generate the new variants. That's why we target on those groups. We want to see whether those variants or new variants in those pregnant and children may generate different severity, or maybe some variant can generate more transmission, and maybe some variant can escape vaccine efficacy. And that is what we want to understand and want to model the impact of such those variants. Okay, and eventually we want to get the result and hope that we can understand it and can get some recommendation and have some impact for the public health. Okay, in this study, we also share and coordinate a lot. I learned a lot from this project. Okay, this already, the main project has not only the household transmission which we involve, but they also have some part that study about vaccine efficacy, some pregnancy and infant data, and some have even biobank generation. You can see that the project starts from November 2021 and will be end on 2025. So right now we are kind of 1.5 years of the project. Okay, the good thing of this project that I like pretty much is that is focused on utilizing the existing study of surveillance of public health that already have in that country or in that institute. And the analysis, everything has done by the local or the site, but anywhere they will support for analysis if you need, and also they will share and get some frequent follow-up meeting to help us for analysis and modeling if we need it. Okay, so I will stop here and just not allow in case that we need to have some more discussion, because the time is not much, I believe.
Yes, thank you so much also for this introduction to the Verdi project. So we can see, of course, there's already very active participation of ASEAN research institutions in Horizon Europe funded projects. Now, I hope that Hans can also join us, or Mustafa, if he's still available. But of course, we would like to know from all of you some information perhaps on how did you become involved in these research consortia? Maybe if I ask first Professor Propandari, how were you aware of the consortium, of the call that was opening, and that there was a consortium in the process of being formed? How did you become involved in the project?
Yeah, Thank you for the question. So in 2018, actually in that time we have already the collaboration, particularly with University of Groningen for some time. So we have already some collaborative academic activities. In that time, our partners and the University of Groningen share the information about Horizon 2020 project, and would like to have my institution as one of the partners. And after that, we have some kind of online meetings together to create the ideas, the concept notes, as well as the proposal. So that's the beginning of the SANISI project.
Thank you so much. And perhaps Professor Aruni can also share a little bit from her perspective. When you heard about the Verdi project, how did you become involved in the process? And perhaps what can our audience members today learn? How should they, what should they do to become involved in Horizon Europe Research Consortia? What is your advice and your experience?
Thank you very much. I think for me, it's a bit lucky that because I'm a pediatric infectious disease expert by myself and also virologist. And during the outbreak of SARS-CoV-2, I'm working with SARS-CoV-2 from starting. So instead of I fight them, they fight me. They contact me. In fact, actually, one of the coordinator in Penta Foundation used to work in Thailand, Dr. Mark Lalamont, and because he worked because Penta have ID network in children so well established, and also Dr. Mark Lalamont used to work in Thailand in Chiang Mai, and he did a long-term research about HIV, maternal infant transmission for maybe I think more than 25 years in Thailand. So that's why he and I knows in the past quite well. And that's why when Penta start to find a partner, he just contact us and ask if you want to join. Of course, I just don't let the opportunity go on. I just join them. And that's what we start. This part is kind of, we are quite lucky that we get contact.
Thank you so much, Dr. Aruni. I'm taking over for Dr. Susanna because her dog is on the roof. We love our dogs, but sometimes they do crazy things. So she will be back once she finds the dog, reaches the dog. So Mo, I would love to bring you here. I saw there was a slide from Hans on some tips, on becoming part of the EU proposal. So Hans, if you don't mind, and if you're here, otherwise Mo, can you also share some tips on leading a multi-partner EU projects? It's very interesting.
Maybe, can you hear me now?
Yes, Hans, please do so.
Okay,
and
I'm still on the
bring
train.
Mo in. Yeah.
Yeah, so Mo can continue if I'm not able to complete this. So really the way we started it, I've also had this experience in working with Thai partners for the last 25, 30 years. So that's really how it started. If you have a person that because you cannot apply for EU funding without having a European partner. So that's important. I think we were lucky because I had a dual position, both at the Thai University in Khon Kaen and the University of Norway. So I applied as the coordinator at my university in Norway, and then we could set up the project in that. But I think here are some of the points that are important to think about. You have to start earlier. Even if there is no EU call, you have to start formatting your project and start building the team, invite new partners, and then by the discussions and workshops and so you share ideas and you get to some new interesting objectives that you could work on, develop a project and that. You have to have regular meetings, and if you're leading a project, if you're leading your team in Thailand, for Southeast Asia, for example, you have to make sure that people are delivering in time. So we set strict deadlines, and with the budget, for example, if you have a specific budget, the roof from the call, the way I did it was just like, okay, we divide the maximum amount by the number of partners, and this is what you can work with, and then there will be adjustments. So in the end, some partners will get more, some partners will get less based on the activities that they're doing. It was also mentioned before the national contact points, and we also got help from a consulting company in Italy that was paid by the Research Council of Norway. And if I can continue, it's not an easy task to work with a project with many partners. It's like herding cats. It's the comparison. So you really have to push people all the time. It's not very pleasant always, but it's when you have the meetings, it's quite enjoyable. And I think also for our project, it was important to use this transdisciplinary participatory process to be able to work, because with partners in the field, with the government, with our partners in the countries, and working across disciplines, working across national borders, working with the different organizations. So this setup here is still very important. We're now having regular transdisciplinary workshops so that we have a better communication system in the project. And this is quite important to start doing in the beginning of the project. So now we have the first 6 months of the project, and we're just in the middle of this process at some point. So what I mentioned before, we have systems analysis to understand the locations where we're going to work, because we really have to work with the people, with the environment, with the animals in those areas. And then we're focusing on implementation research. And these two dimensions really were part of the actual call itself. So we tried to figure out a good way to envisage what the EU wanted from this call. So I think that's really, I don't really need to say so much more about the project, because we haven't really started. I mean, we will collect data from local markets. This is like the background of what's causing the diseases. And I already mentioned these two domains, systems analysis and prevention. So I think I can finish there, unless Mo has some good points to include. He really has some really good points sometimes, so maybe Mo, you can say something as well.
Thank you, Hans. I just would like to echo what you have mentioned briefly. It's very important to create a team and rely on a brilliant idea that you share the same passion and you share the same goal that you want to achieve, and also spend some time to brainstorm it and try to address the problem from different perspectives, and then set a plan and be very clear and strict on the timeline and how to achieve that, and definitely you will reach your goal. That's all. Thank you.
Yes, thank you so much. And I think Hans' presentation was very interesting as well, because I think what he emphasizes is the need to continuously network. This is not something where you just jump in at the last minute and you put something together within a couple of weeks. But as Hans has said, you really need to build a network of collaborators. You need to have an idea and have forward planning. And here in Southeast Asia, we also have a lot of European researchers who are working across the region. And you should not ignore these colleagues, because they, of course, also have a foot in the door at institutions in Europe who are potentially your collaborators. So you should, always make the most of these low-hanging fruit, as we say as well. So build a network, nurture the relations, be forward planning as well. And of course, make use of all the information and the support that is available online, like our NCP speakers today. This is a fabulous tool. In fact, Jenny is an NCP herself for the Marie Skłodowska-Curie Action. So we have really a great support network in Europe that can also help you making the connection. I think it was Professor Aruni who said that she didn't find someone, but they found her. And we hear this very often. This is also important, that you make yourself visible by using all the platforms and the matchmaking opportunities that there are, that European institutions that are looking for partners in Southeast Asia, they find you. When they're looking at the internet, you are the institution or the researcher that they're finding. So you have to make sure that you are visible yourself. I think we've come to the end of today's session, and I'd like to once again remind you that we have created a survey. We would like you to fill in this survey, give us information about yourself, and give us also information about what you can bring to potential research collaborations with relation to the calls that we've presented today, so we can perhaps help you to reach out to collaborators in Europe. But as we said at the beginning, this is only, sorry, this is not working exactly. This is only one event in a series of events. We have 3 more sessions lined up for you. Next month, we're looking at food sciences. In August, we're looking at sustainable energy research, and then in September, we're looking at space technology and application. So again, we'll be presenting specific Horizon Europe calls where we think there is an inward route for institutions here in Southeast Asia. But again, just a reminder, there are lots and lots more calls in the current and forthcoming Horizon Europe work plans. So do make sure you familiarize yourselves with the funding and tender portal. Now I hand over to Jenny, because she has an announcement to make also about the tutorial that we've created for you.
Yes, thank you, Susan. So we were supposed to have a tutorial right after this, but it has been a very long but a very enriching session for everybody. So we will schedule that a little bit later. So please keep in touch with us. All of your emails we already have, so you are part of our database. We will send you the link to this session. We will premiere it, and in this session with our colleague Dalibor, you will get to know, I mean, the question, the sustained questions that we always have, how to start, how to find the proposal, how to build partnerships, and all the other things that are still in your mind. So we will make sure that the answers are there. So please just wait a little bit. We will also send the presentations after we get the go-ahead from our speakers as well. So with that, thank you so much to our speakers. It has been an excellent session, Susan. I cannot be thankful enough to all of our speakers for these incredible sessions, and we had really active participants as well. So we hope that you keep on participating, because there are other calls that are happening, and please also keep on looking at the funding and tenders portal as well. Susanna?
Thank you so much, Jenny, and also from me, thank you so much. Thank you, all our attendees. We do hope to see you in the next round of applications and also at the next EU-ASEAN events. And do keep in touch. We're always happy to support you. Thank you again to our 3 final speakers. It was a pleasure. Thank you so much. Have a great evening, everyone.
Thank you. Bye-bye.
Congratulations to Lani, Susan's excellent daughter who will be graduating tonight.
From primary school.
From primary school, still very important. Thank you, Dr. Palami.
Thank you so much.
Thank you,
See you all soon.
Bye-bye.
Okay, thank you. So see you next time.
See you next time. Good night.
Good night.